Hello, my name is Tyler Smith, and for my final video presentation, I'll be talking about the Ebola outbreak. So what is Ebola? Well, the Ebola virus causes an acute, serious illness which is often fatal if left untreated. The average case fatality rate is around 50%, and this can vary between 25 to 90% in past outbreaks. And a little bit of history about Ebola is in 1976, there were two simultaneous outbreaks, and one was in Nazara, South Sudan, and the other one was near the Ebola River, which is now in the Democratic Republic of the Congo. And 2014 to 2016 outbreak in West Africa was the largest Ebola outbreak since the virus was first discovered in 1976. And this is kind of the highlight of the case study I'll be touching upon. But what's unique about Ebola is it's animal to animal, and then there's a spillover effect to the human population, and then humans can infect other humans. So after the spillover takes place, then it becomes a human issue. So now I'm going to focus on the primary signs and symptoms of Ebola, and then symptoms may appear anywhere from 2 to 21 days after contact with the virus, with an average of 8 to 10 days. The course of the illness typically progresses from dry symptoms initially, such as fever, aches, pains, and fatigue, and then it progresses to what's called wet symptoms, which is diarrhea and vomiting, as the person becomes sicker. And what's a problem about this is that many common illnesses have the same symptoms as the Ebola virus disease, including influenza, which is the flu, malaria, and typhoid fever. As you can see, we have fever, aches and pains, weakness and fatigue, gastrointestinal symptoms, abdominal stomach pain, and unexplained hemorrhaging, bleeding, or bruising as all symptoms of Ebola. So now we get into the topic of why should we be concerned. So I know that the Ebola scare was a huge thing in American media, blowing it out of proportion about how dangerous and deadly this virus can be. But Ebola virus disease is rare, but it's very severe and often deadly. And it spreads through contact with the infected, and it's either, from the spillover effect with an animal or people to people. And then the recovery from the Ebola virus disease depends on access to supportive clinical care and the patient's immune response. And studies show that survivors of the Ebola virus often have antibodies. So what's interesting about this is that, just monitoring the person and like having them in the hospital and giving them enough fluids and stuff is really influential into them for them to recover. So now I'm going to be mentioning the geographic distribution of Ebola across the US and the world. So the virus has emerged periodically and infected people in several African countries. As you can see on this map, the central region and the western region have the highest transmissions of Ebola. There are 6 species of Ebola, but only 4 of them transmit to people. The 4 of them that transmit to people can be seen in the bottom left-hand corner of this map. And 11 people were treated for Ebola in the United States during the 2014 to 2016 epidemic. And this was the largest epidemic ever recorded since Ebola was discovered in 1976. So now we're going to be looking at the GIS-based case study. And for the title of the case study that I've been working with, it's the spread of Ebola virus disease based on the density of roads in West Africa. And the journal it's published in is Geospatial Health, and it was published in 2017. And then there's numerous authors as seen down in the author section. So now I want to focus on the conceptual design of this case study. So the objective. The objective of the study was to show how the road density index, which is abbreviated RDI, and you might see this again, could be constructed and used as a proxy of population movements in the region. So it basically analyzes how the road density index and Ebola are related. And some factors relating to this are habitat, which is the road network density, which I put as the built environment. And then another habitat issue is the high population density, which has social implications as well as built environment implications. And then it's also affecting behavior because it has high mobility levels. Ebola is known to cause a great migration of people away from their villages to seek medical care, and then also people returning to medical villages to be with their family. So this is some characteristics of that. So now we're going to be moving on to methodology design. So the methodology design that I thought this case study was retrospective cohort, and this is because it compares the relative risk between the density of road networks and the increase of Ebola infection. And this is kind of interesting because it compares data from the past and then synthesizes it with this crazy formula, which is called the spatial temporal mixed zero inflated negative binomial model. And then it comes up with the result that the relative risk is higher when the density of road networks is greater. So the density of road networks and the increased Ebola infection is tied together, which is kind of interesting, and I'll touch more upon that later in this presentation. So now we're going to move on to data collection and the exact scope of this case study. So the study was carried out at the district level across the 3 affected countries, the Republic of Guinea, Liberia, and Sierra Leone. So how was data collected? Well, the data regarding the spatial information of road networks of the 3 countries was downloaded from the Socioeconomic Data and Application Center. Population data for 2010 was obtained from the Gridded Population of the World, which is a raster file from the Socioeconomic Data and Application Center. And then the Ebola virus disease cases for the study were cases that were reported in Western Africa from the start of the outbreak in the first week of 2014 through week 21 of 2015 for the 3 affected countries. And this was information provided by the World Health Organization Global Health Observatory. So now we're moving right along to the application of GIS into the case study and how the data sets come into play. So the spatiotemporal mixed zero inflated negative binomial model that was used to estimate Ebola risk and road density index is shown. And this model is fairly complicated, but we can break it down because T equals the number of Ebola cases in week J and density of K, where RDI equals the RDI in week J and district K, whereas week equals week J in district K, and district K equals district K. So just breaking this down, this formula is pretty complicated, but nevertheless, it gives us our relative risk ratio of 1.037, showing that there is association between the road density index and the Ebola incident. And our confidence interval lower bound is 1.010, and our confidence interval for our upper bound is 1.066. So this is assuming 95% confidence. And figure 1 shows the administrative areas of the study region and the road system. And figure 2 shows the global Ebola virus incidence rates during the outbreak. So the combination of both these maps gives us our relative risk ratio, and it does show that Ebola is more likely when the road density index is higher. So now we're moving on to some of the graphs and charts that were used in this case study, and I apologize if it is a little hard to see, but there's a lot of information and there's not a lot of slides, so they're all here though, and I hope you can make sense of them. So for figure 4, we're looking at the per week relative risk of Ebola virus disease cases adjusted by the road density index. And for figure 3, we're mainly looking at the population distribution in the study area. And it's important to note that the population tends to be concentrated in large urban areas, which have high densities, and then much of the other areas do not have such high densities and have lower densities compared to these urban areas. So the urban areas are mainly along the coast, as you would expect. And then table 1 shows the road density index for the districts in each of the 3 countries studied. And it also shows the number of accumulated cases, population, and the area for each district. I do apologize, it is hard to read, but it's breakdown by country: Liberia, Republic of Guinea, and Sierra Leone. And then it gives us the different districts, and then it analyzes the road density index and infected cases, population, and area, and just the key kilometers of roads. So this is important to know. So for the results and discussion, the results of the model showed an association between the road density index and the rates of Ebola infection. An increase of 0.01 in the density of the road network per kilometer squared resulted in a 3% increase in Ebola infection risk, with a relative risk at 1.04 and a confidence interval of 1.01 to 1.06 at 95% confidence. So for our conclusion, the density of the road network influences the incidence of Ebola cases in the affected zone. And then this information should be considered for risk evaluation in a way that would aid the distribution of resources in an emergency situation, so it is useful and very practical in society. And then finally, an exhaustive mapping of the area could help relevant organizations better manage other outbreaks in the future. So applying this knowledge to the real world can really make a difference and change our society and maybe help with Ebola outbreaks in the future. So no case study is perfect, and these are some of the limitations that the case study itself mentioned as some problems, underlying problems. So there could be unmapped neighborhood byways that could be used for movements in between villages, even though the study affirms that the information about the road networks is fairly complete. But with our technology today, it is hard to say for certain that all these road networks are complete, and especially with an underdeveloped area such as Central Africa, it might be easy for people to use a small path to travel between a couple villages. So, and then also, the breadth of this data itself is inadequate. So complete information about road networks and population movements is also needed. Some of the things in the study, the case study mentioned, is that population movement is very hard to track in this area because borders are practically non-existent. But to combat this, new technologies such as satellite-generated remote sensing images or application of GPS, our global positioning systems, offers a new opportunity to track this in real time. So it's pretty fascinating, but technology is definitely moving case studies such as this forward. And here is my reference list.